video from Gretchen in New Jersey.
Help me, panel. I don't know what to do. My child is so active. He acts out all the time, especially in school. His teacher has complained a number of times. I've even taken him to the doctor, and they gave me a prescription, but I just don't feel comfortable giving him medication. What else can I do? And what do I need to know about ADHD so that I can take care of my kid?
Thanks, Gretchen. That brings us to the topic of today, ADHD. Specifically, the problem with it. The problem that is being found in America today is the overdiagnosis of ADHD. When trying to solve this problem, we have to ask ourselves a few questions. First, what is the definition and diagnosis for ADHD? Secondly, does ADHD even exist, or is it merely a culturally constructed myth? Third, how is ADHD treated, medically and otherwise? Fourth, what is the psychological effect on the kids that are diagnosed with ADHD? According to the Diagnostic and Statistical Manual of Mental Disorders, ADHD is defined as a persistent pattern of inattention or hyperactivity impulsivity that is more frequently displayed and more severe than is typically observed in individuals at a comparable level of development. There are three subtypes of ADHD: hyperactive impulsive, inattentive, and the combined type. Each of these subtypes have 9 symptoms, 6 of which must be present in order for diagnosis. The combined type requires 6 of 18 symptoms to be present. Symptoms of ADHD include careless mistakes in schoolwork, messy or incomplete assignments, failure to pay attention, failure to follow instructions, lack of organizational skills, loss or disorganized materials, and being easily distracted by extraneous stimuli. Generally, teachers and parents play a large role in the diagnosis of ADHD. Questionnaires are filled out, and the doctor consults the teachers and parents about the child. Between 3 and 5% of kids are diagnosed with ADHD, though some studies say it's more like 4 to 12, and other studies say 20 to 24. Regardless, 95% are boys. That brings us to our second question of whether or not ADHD even exists. Bioevolutionary theorists and ethologists don't believe it does. The main reason is that boys and girls develop differently. Boys generally are more aggressive, while girls are seen more as docile. This is seen both in humans and in the animal world. It is believed that during the beginnings of man, men need to be more aggressive, more impulsive, in order to better survive. Women were not required to have these traits. These traits now correlate with ADHD symptoms such as fidgeting, climbing and running in inappropriate situations. So instead of ADHD being conceptualized as a neurobehavioral dysfunction, it is more likely millions of years of male adaptation. Treatment for those diagnosed include drugs and special or altered activities at school and other places in which ADHD causes problems. My associate will talk about the effects it has in school.
Like he said, ADHD, of course, affects the learning process immensely due to the great amount of inattention and rambunctious behavior. At school, teachers usually are the first to notice and refer children with ADHD for assessment and treatment, and they make recommendations that about the ADHD that parents, whether they're incorrect or correct, they tend to follow. In a study of teacher awareness of ADHD and how to respond to it, a majority of teachers knew how to identify ADHD. A minority of them didn't know how to treat it. And also many teachers don't know that diet changes are not successful treatments. So there's just a lack of knowledge about the treatment of ADHD within our our school systems. ADHD kids at school are also treated differently because they're not held responsible for their ADHD symptoms. For example, like, oh, Billy is acting out just because, he has ADHD. And teachers also attribute behavior or social functioning to ADHD when it could be the child, him or herself, with like social problems, or if they're just in a bad mood or something's happening at home or something like that. What I've also found is that overall, teachers generally do not see medication as particularly useful. Both teachers with high and low knowledge of ADHD do not think medication is generally necessary, and I personally feel that medicating your child would mask the problem instead of dealing with it. Of course, teachers expect ADHD kids to act up more, and teachers with more ADHD knowledge actually report lower confidence in handling them because they feel they haven't had the training to handle ADHD children. Something else I've found, though, is that recess plays a large part in venting and just getting rid of some of the pent-up energy they might have. In general, children are less attentive with more classroom confinement. And for all children after recess, attention and classroom involvement improves. And this is especially true for ADHD children because they need a chance to get rid of all their energy. In an experiment with 43 fourth graders, 5 of which had ADHD, all of the ADHD children were more on task or less fidgety after recess. 6 kids were less on task, and they weren't even the kids with ADHD. And it's also been studied and found that inappropriate behavior with ADHD kids escalates as the morning goes on in school on days that they don't have recess. But on days they do have recess, they are able to get rid of all their energy. So overall, it's found that the effects of recess are greater for children with ADHD. So what can help the problem in school? Well, first of all, as I've mentioned, is educational support. If the educators know about the ADHD and how to handle it, the grades should go up. Changes to the home life, changes within the classroom, as I said, and training sessions for teachers. If teachers are informed, then they can help and make changes, such as recess, to help handle and deal with the ADHD so that medication isn't the route. Do you have anything to say about medication?
Yes, thank you. Not only is overdiagnosis an issue, but overprescription is a problem also. So what is the most common method of treating ADHD? Methylphenidate, commonly known as Ritalin, is a type 2 drug that has been found to cause psychoactive effects that last longer than those of cocaine, and some of those effects include persistent brain dysfunction and potentially irreversible central nervous system damage. So with these aspects in mind of methylphenidate, why are they in use? In today's society, people strive for the quick fix to most of our problems. If you have a cold, you're supposed to get an antibiotic. If you're having allergy symptoms, go take some Benadryl. If your child's out of control, Ritalin is the common method of fixing it. Statistics show that 8 to 10% of students in grades 2 through 5 in 2 cities in Virginia received medication for ADHD during the 1995 to 1996 school year. We must evaluate the side effects before we commit ourselves and children to a life dependent on Ritalin. Children are exposed to effects such as they might feel that something is wrong in their brain, they have been given pills instead of love, and they have been given medication instead of love and spiritual support. These individuals often blame themselves for wanting more love and attention than they have been given. On a more specific level, Ritalin is a cause of some psychological as well as physical disorders. Research shows that methylphenidate has been associated with weight loss, personality changes, social isolation, depression, insomnia, increased blood pressure, cardiac arrhythmia, tremors, weakened immune system, growth suppression, agitation, fatigue, accelerated resting pulse rate, visual disturbances, drug dependency, anorexia, nervous disorders, aggression, and liver dysfunction. The brain, immune system, and cardiovascular systems are all shown to be affected by Ritalin use. So how do we effectively and healthily cope with ADHD? The best recommendation is to talk with your child about the issue. Not only is it a parent's job, but also a physician's or psychologist's job. Prescribing medication creates psychological problems. One problem with medication used for neuropsychiatric patients is that it fosters an atmosphere in which the doctor takes control instead of helping the patient control himself. Dispensing medication relieves the adolescent from accepting accountability for causing pain and shame to oneself, family, and friends. Unfortunately, many youth have already been damaged by this thinking that removes the burden of misbehavior from the child. ADHD is similar to other mental and physical disorders. If we don't address the cause of the problem, how do we ever expect it to be fixed? Point taken that most people believe it will be outgrown by adulthood, but during those 10 years of childhood while they're taking Ritalin, what kind of pain are we willing to inflict on our youth, the future of the world? The final point to remember is that every time we drug a child, whether it's due to ADHD or allergies, we are choosing our convenience over the child's real needs.
This brings us to our last point, the psychological effects on kids that are diagnosed with ADHD. Generally, kids diagnosed with ADHD are stigmatized because they are given medicine and special treatment at school and at home when there are other siblings around. This makes them somewhat of an outcast to the rest of their peers. Having this outcast or special kid title makes it very difficult for them to make friends and form relationships. This causes a problem for them when they're kids and also later in life because they are unable to learn the skills as kids that they need to learn in order to form relationships when they're older. Also, many kids that are diagnosed with ADHD and are given prescriptions such as Ritalin are less responsible and don't find themselves accountable for their actions. They find that they have the right to blame it on their disorder. This can cause problems when they're younger by acting out at school, lashing out at their parents. Later in life, it can cause problems with the law, which is much more serious. These are the common effects on kids diagnosed with ADHD.
Well, I hope something we've said today can help you, Gretchen. Good luck.
Hi panel, thank you so much for your help with my son. It gave me so many other options other than medicating him. Now, we've made improvements both in the classroom and at home, and he understands now that the playground is the place where he can let all his energy out, and he's able to focus more at school, and is now also getting better grades. Thanks again. Help me, panel. I don't know what to do. My child is so active. He acts out in school, and his teacher has complained to me a number of times. I've even taken him to the doctor, and they gave me a prescription. But I just don't feel.
I'm a skateboarder.
I just don't feel comfortable.
Mom, wait. Look, now you go backwards.